Today we will know about the placenta. Now what is placenta? Its definition. Placenta is the feto-maternal organization. Feto-maternal organization in the pregnancy inside the uterus of a pregnant female, inside the uterus of pregnant female, for the purpose of weight. Now what is weight? Weight is the waste elimination. E for essential nutrients. I for to combat infection, internal infection. G for gas exchange. H for hormone in order to maintain the pregnancy, and T for thermoregulation. For these purposes, there is a combined organization during pregnancy. That is called placenta. About its gross anatomy, its shape is discoid. Its color is reddish blue to crimson. Its size, length 22 centimeter and thickness is 2 to 2.5 centimeter, and it occupies 20 to 30% of the uterine cavity. Common site is the posterior wall and the fundus of uterus. Near the fundus of uterus. Okay. Now it has got, its weight is 500 gram, and the blood flow inside the placenta at turn, here the weight is 500 and that is 600 to 700 milliliter per minute. Okay. Its surfaces, the fetal surface where the umbilicus is attached at the center, and it is smooth, having shreds of amniotic membrane attached to it. And second, that towards the uterine cavity, towards the maternal side, it is the rough surface, the placental surface. Sorry, this is fetal surface and this is maternal surface. Maternal surface, it is rough and showing cotyledons, that it has got 10 to 15 cotyledons, the separating structure, cotyledons. Okay. Now coming to its histology, it is made up of 3 layers. As I have said earlier, it is feto-maternal organization, and here is the umbilical cord. So towards the umbilical cord side, this is the chorionic plate, and this is solely a fetal contribution, that it contains chorionic villi. Okay, chorionic villi having the umbilical vessels, and towards the maternal side, this is the embryo towards the embryo, and this is towards the maternal side. That is the uterine maternal side. This is the basal plate, and in the middle this is the middle sinusoidal layer. This basal plate, it contains spiral vessels, which is solely a maternal contribution, and in the middle this is sinusoid, which is comprises of the villi and plus lacunae full of blood, villi containing umbilical vessel, this is the fetal contribution, and lacunae with blood, this is the maternal contribution. And here the exchange occur of oxygen, CO2, nutrients, waste. Nutrients and oxygen is taken from the uterine aspect, that is the spiral vessels, and through umbilical vessels the CO2 and the waste product is going out inside the lacunae and then through the umbilical vessels. Now a little bit about the development. First there is a 1 cell stage, then 2 cell stage, then 4 cell stage, then 8 cell stage, then 16 to 24, that is called the morula, and then the highly compact, then it is called blastula. Then comes blastocyst stage, in which there is trophoblastic layer, and there is inner cell mass and the fluid filled cavity, that's why it is called blastocyst. And after that, the outer one, the trophoblast, is divided into two group of cell, that is the cytotrophoblast and the syncytiotrophoblast. Cytotrophoblast has got nutritive value, whereas the syncytio has the invasive value, invasive character. Okay, and in between here is the inner cell mass. Now inner cell mass differentiate into two type. The upper one is columnar and below is the cuboidal. This is the bilaminar stage. After that, this is cytotrophoblast having nutritive value, and the outside this is syncytiotrophoblast having invasive property. This cytotrophoblast again give trophoblastic bud. This trophoblastic bud is coming out, forming the villi, and syncytiotrophoblast is encircling that villi and making their path clear by invading the endometrium. Okay, and here is the bilaminar stage. This is the bilaminar stage, and then this is the upper layer, and this is lower layer, and there is a cavity, and this is somewhat flattened, and this also get flattened. This is the yolk sac, and this is the amniotic cavity. Now yolk sac excrete primary mesoderm which encircle, and this cell mass, inner cell mass, is now getting attached with the trophoblast with the this is the umbilical, going to form the umbilical vessels. Okay, this is the connecting cord, and now it is secreting the primary mesoderm, which is going to encircle this yolk sac, and then here also, and it is connecting. And now the cavity, this is called the extraembryonic mesoderm, here where it encircles the yolk sac, and at the level of this embryo, this bilaminar disc, it is called intraembryonic. Here is the intraembryonic, and this is extraembryonic, and this is also extraembryonic mesoderm here, and this is also extraembryonic mesoderm around which, and this is our cytotrophoblast, and it is invading the cytotrophoblast. Now this extra embryonic mesoderm again enter inside the cytotrophoblast, invade, and now this this is called primary villi. Only the cytotrophoblast is there, and when there is extra embryonic mesoderm, this is called secondary villi. And later on, when the blood vessels begin to form, the blood vessels also enter inside. And now after the blood vessel, the cytotrophoblast, then plus extra embryonic mesoderm plus the umbilical vessels, or you can say the blood vessels. Now this is called tertiary villi. Okay, and we all know that the uterus has got three layers from outside inward. This is the perimetrium, myometrium, and endometrium. This endometrium is again of three: the zona, the stratum basal, and which is the basal layer, and this is two are functional layer, which is towards the luminal side. This is a stratum compactum, and this is a stratum spongiosum. Okay, towards the lumen side, this is a stratum compactum, and this is a stratum spongiosum. Now this is invading the stratum compactum and going inside the stratum, making its a space inside the stratum spongiosum, the middle layer, stratum spongiosum. Okay, and this is stratum basal. These two is called the functional layer. And when there is, and then when pregnancy continues, there will be when there is no menstruation occur, this good news is going to the corpus luteum inside the ovary, as it secrete HCG, and this message is going via blood to the corpus luteum inside the ovary, and now corpus luteum turn into the corpus luteum of pregnancy, and it secrete progesterone, which which activate the proliferation of endometrium, and now this endometrium turn into the decidua. Decidua means endometrium when full of glycogen and the lipids, and make very much nutritive, have got nutritive value for the developing embryo, then it is called decidua. Okay, and now we can divide this decidua into towards the embryo side. This decidua is called decidua basalis, and when this is, suppose this is the whole uterine cavity, and some decidua is around the embryo towards the uterine cavity. This is called decidua parietalis, and decidua capsularis. Decidua capsularis, and over whole of the uterine cavity, this is called decidua parietalis. And where the embryo is implantation has done towards the uterine wall, that is called decidua basalis. So the precursor of placenta is the decidua basalis and the chorionic frondosum. These villi, the trophoblast, cytotrophoblast, and cytotrophoblast, these are the villi, and this is called the chorionic frondosum. Okay, and because here it get flourish, the primary villi, tertiary villi, secondary villi, tertiary villi, and towards this side where implantation has done, the villi becomes more larger and larger, and now it is called chorionic frondosum. And rest of the site there is also villi, but very less, and giving somewhat smooth architecture, and that villi is called chorionic lavi. Chorionic, L-A-V-I-E, chorionic lavi. Okay, and according the primary, secondary, tertiary is according to its constituent, and when it is classified according to its action, then it is known as anchoring villi, and the nutritive villi or the side villi. And how it happens, this anchors, this is the side from the chorionic villi is going inside, invading this syncytiotrophoblast, and here is the uterine artery and vessels are there, and they erode the uterine vessels, and now here is the lacuna formed, inside the stratum spongiosum lacuna, where the free flow of blood occur, because this syncytiotrophoblast also invade the uterine vessels, and this lacuna is now full of blood, and now placental membrane is created through which exchange occur. Placental membrane composed of 4 layers from inside out. It is the First, there is umbilical vessel, then extraembryonic mesoderm, okay, then cytotrophoblast, syncytiotrophoblast, and then comes blood of the maternal blood inside the lacunae. And after 20 week of intrauterine life, this placental membrane reduced to 2 only. And what remains? That is the syncytiotrophoblast towards the maternal side, and the capillary in the umbilical vessel endothelium towards the fetal side. Only 2 membrane, and the rest that is the extraembryonic mesoderm and the cytotrophoblast vanishes. Okay, and now the fibrous septa from the maternal side is coming inside and divide the whole placenta into 10 to 15 cotyledon, in which in one cotyledon there are 3 to 4 chorionic villi are there, and they are making exchange. And this fibrous septa is not continuous, and they are continuous above, but below it is lacking. So the maternal blood flow can occur from below the below the septa, and there is also Nita Buck's membrane. One is the Nita Buck's membrane, and the just after the cytotrophoblast there is a fibrinous degeneration of the syncytiotrophoblast. It gave to which give rise to a membrane that is called Nita Buck's membrane, NITABUCH, Nita Buck's membrane. And it has got very much clinical significance that if Nita Buck's membrane is not there, it adhere too much with the uterine wall, and that is lead to the placenta accreta. Nita Buck's membrane help in the separation of placenta after the delivery. Okay, it restrict the territory of the cytotrophoblast. It restricts the activity of the cytotrophoblast and the syncytiotrophoblast so that it cannot erode too much inside the uterine wall. Okay, and there is here is the placental organization occur, that in the first layer, that is called here towards the embryo, this is the chorionic plate, and towards the maternal side is the basal plate, and in the middle there is sinusoidal layer which is full of chorionic villi and the blood filled with lacuna. And here only the chorionic villi containing the umbilical vessel, which is the fetal contribution, and towards the maternal aspect only the spiral vessels are there. Now coming to the function of the placenta, that it help in the, it has got metabolic function, it has got endocrine function, it has got exchange function. Okay, in the metabolic it stores the glycogen and the lipid. Okay, and the endocrine it gives rise to HCG, then human placental lactogen, HPL, also called somatomammographic hormone, and estrogen, progesterone, ACTH, TSH, and as well as relaxin. These hormones are secreted by the placenta, and exchange of the gases, that is the O2 and CO2, and also the waste product like urea and or other respiratory product. There is also exchange of amino acid occur. Okay, and the water, and there is also exchange of one parasite occur, that is known as Toxoplasma gondii. And virus is cytomegalovirus and the cytomegalovirus and the rubella. And in the bacteria, no bacteria can cross except Listeria monocytogenes, LT is Listeria monocytogenes, and one is Treponema pallidum. Okay, this they can cross. And now coming to the clinical significance, they are patch. Patch, what does it mean? Placenta previa, placenta accreta, and the torch infection, chorioamnionitis, and the H for and the hurry up placenta, that is the abruptio placenta. When it prematurely gets separated, then it is called the abruptio placenta. And when there is infection of chorion as well as amnion, chorioamnionitis, torch infection, in which the torch infection, in which there is toxoplasma infection and the rubella and the cytomegalovirus and the herpes simplex. And this is placenta accreta, which is adherent, which is adherent placenta is called, and placenta previa when it comes in to as the internal os, then it is called placenta previa. So this is all about the placenta. Thank you.